what would be good is, in terms of talking about what are any of the main barriers to people choosing to get the vaccine that we're aware of at the moment. I know in the last Q&A you mentioned, for instance, that certain ethnic communities had an issue over the Pfizer vaccine, so it might be good if you just mention that again. Any other things that have been identified as a barrier to getting the vaccine for people?
Thanks, Kimberley. And I think, so probably the biggest barrier, the question people have is it safe? Is it safe for me to have it? It was developed very quickly. How well or how rigorous was it tested and that type of thing? So one of the first things to overcome is to reassure people that it is a very, very safe vaccine. In terms of its development, it would have been tested on 40,000 people as part of that program. And the science behind that then is scrutinized by, we have every part of the world has their own regulatory authority for how we approve vaccines. So in the UK, it's called the MHRA, Medicines Regulatory Authority for us. In America, it's the FDA. There's another one in Europe. All of those bodies have now approved their vaccines in their own regulatory requirements. I think the other thing I would say, which is when coming back to how many people we've vaccinated, we know now that we've vaccinated 15 million people. And the evidence is that very, very, very few, a tiny, tiny minority, have any sort of significant adverse reaction to it. And very often that's for people who have had some sort of a significant allergic reaction in the past. The vast, vast majority of people who have their vaccination, either first or second dose, will have a couple of uncomfortable but not unfamiliar side effects as a result of it. So painful site from where the vaccine was administered in your upper arm, in the muscle here. It can get a little bit red, it can get a bit inflamed. Some people report that they have a headache for a day or two afterwards, and some people just feel a bit like you're a bit run down and a bit jaded. They might feel like that for a day or two. And for most people, that's all that they will feel as a side effect as a result of having the vaccine itself. So when we were talking about developing the vaccine, we tested on a population, and then we draw inferences, we get results from that, and we draw that out and make assumptions about what that might look like for the wider population. For 15 million people to have been done now, we're very clear this is a very safe vaccine that we have, the two vaccines that we have in the UK. I think the second part of the barriers is about, is it effective? Is it worth me having it? Does it make a difference? And there's some it's really interesting emerging information from countries where they have had really good progress with vaccinating their population. So the UK is about third or fourth in the world in terms of the total number of people who have been vaccinated. Israel is one of those countries that have now got some evidence that are showing, as you vaccinate people, the number of people who get admitted into hospital and become seriously unwell has dropped right down. And we're starting to see some of that information come through in our data in the UK as well. It's too early for me to say this is definitely the case. That in the next week or two, I think we will have more and more evidence around that. But a combination of the lockdown, I'll use the common term for a combination of the lockdown and the numbers of people who've been vaccinated, that is now showing through in the total number of people who are testing positive. So if you remember when I said at the height of problems back in January, just 6 weeks ago, we had about 14,500 people testing positive every week. That number is now down to 2,000 people. The number of people who are coming into hospital is reducing week on week as time passes. So we know that a degree of protection is there from having the vaccine, and we can start to see some early signs that that's having a real positive impact in the total number of people who are testing positive, but also then the number of people who are becoming unwell or becoming seriously unwell. We'll need to monitor that in the coming weeks and months. We can't put a definitive figure on it protects you to this percentage and will prevent this amount of deaths, but that will come as time passes. What I can say is we know that from the evidence so far, it's very, very effective. The last bit that I would mention is about coming back again to the issue of whether I should have it or not. People sometimes say, well, actually, if it doesn't completely protect me, why should I have it? And I guess my short answer to that is the benefits of having it are significant and the risks of having it are very, very small. But if you contract COVID, the complications of having it are very serious. The consequences of catching it can be very, very serious for a small number of people. And so if you sort of think of it a bit like a seesaw, one far outweighs the other. The benefits of having it and the risks of having the vaccine, for me, significantly outweigh any of the consequences of not having it, or the risk that you would be taking of not having it. I think the last thing I would say on that was we just need to recognise too how fortunate we are within the UK, how privileged we are, and there are other parts of the world who would love to have the health service that we have, the support that we have for access to healthcare, and indeed the supply of vaccine that we have. For me, we're in a privileged position. We're very lucky to be able to offer it to people as quickly as we have been, and to be able to mobilize as many people as we can to have the vaccine. For me, I think it's a really important thing that we recognize the privilege that we have of being able to do that.